So patients in a lot of sports that require them to be cutting or pivoting around the knee are at risk for ACL injuries. And the anterior cruciate ligament is one of the ligaments that provides stability, the front and back directions of the knee. And so when you tear your ACL, depending on your age and again the status of the hip joint, a majority of patients will undergo surgery for this as they are active and want to continue being active. In those cases, we can't usually just stitch the ACL back together. We have to reconstruct it by taking tissue around the patient's knee or cadaver tissue, and that can establish patients to get back to feeling more stable on the knee and getting back to their activities. An ACL reconstruction is what we call arthroscopically assisted. So we still have to make small incisions around the knee joint. Majority of the work can be done through two small incisions in the front of the knee joint. However, if we are harvesting or taking the patient's own tissue around the knee, we do have to make slightly bigger incisions around that. So you have those small incisions. Generally, this surgery will be done in a surgery center, and it can take a couple hours of time. The patient does receive a nerve block to numb the leg up for a period of time after surgery, and then the patient will usually go home the same day on crutches with a knee brace and bandages. Patients should know that it's a long process. Unfortunately, still, it does take a lot of time for any tissue graft that we use, be it the patient's own tissue or cadaver tissue. That is always a tendon that has to go and make changes to become a ligament. So that process takes many, many months, sometimes up to a year after the surgery itself. And the patients have to just keep that in mind, that it does take a long time of dedicated therapy and time. For somebody who needs ACL reconstruction surgery, they should generally be pretty healthy, and especially if they have a lot of medical problems and they're not very active. Then some patients will elect to treat an ACL injury without surgery, and that can be like a brace, ACL deficient brace, or a brace that acts to protect and heal the ACL and function as the ACL, as well as dedicated physical therapy.